Good afternoon, everyone. Thanks for joining us again. I want to jump right in. First, to let you know that we have only one American Sign Language interpreter today, which actually just means that we're going to hold to about 30 minutes. So I want to jump in with some important information that I think one is likely on your mind and as importantly needs to be addressed. So let's start very quickly with the county dashboard. Currently, we have conducted nearly 170,000 tests, COVID-19 tests, individuals throughout Dutchess County, with 5,130 confirmed positive cases. Now, we're tracking currently 145 active cases in Dutchess County with 6 hospitalizations. And on the dashboard, you'll see, and I'll get to this sadly in a moment, 156 deaths. Now, that identifies some 4,829 individuals who are deemed as recovered. As you likely know, if you've been following the news lately and perhaps have been listening in on the governor's conference calls and press events, the Mid-Hudson region is showing a 2% positivity rate. Now, how that plays out in individual counties is of interest and concern. So, very specifically in the Mid-Hudson region, the shared rate, if you will, is, as I said, 2%. And the Dutchess, so of the counties in the Mid-Hudson region, Dutchess County's infection rate is 0.8%, 0.8%. Orange County is at 1.9%, Putnam at 1.7%, Rockland County at 6.5%, Sullivan at 1.3%, Ulster at 1.6%, and Westchester at 1.4%. And now, as a county, we are currently the only county in the region that has seen a decline in positivity. That is not a moment for us to celebrate, but simply to reflect that we are not seeing widespread transmission of the disease in Dutchess. You are, however, aware of several clusters of significant concern in Rockland and Orange counties and in New York City. The governor has spoken about this. We certainly know the zip codes where these have occurred, and the state and county and local governments are responding to the increased positivity rate in those communities. We work with our partners. I can tell you that our Commissioner of Health is in regular communication with the Departments of Health in those other regions and certainly in counties and certainly other regions across the state. And I want to give compliments to my colleagues in county government. Steve Newhouse and Ed Day in Orange and Rockland counties, respectively, have done a tremendous job working with local officials, working with communities that have a transmission concern, and have really been cooperating with the state to address these concerns. Now, we in Dutchess County are not seeing widespread community transmission. However, we do have an identified cluster, which we've discussed before. The Hedgewood Assisted Living Facility in Beacon has recorded a total of 71 total cases. Now, remember, that includes staff and residents, and total cases, confirmed cases, not the same as current active cases. So, 71 confirmed cases, staff and residents, emanating from the Hedgewood Assisted Living Facility. Sadly, we have seen now 3 individuals at Hedgewood succumb to the disease. The first one we shared with you last week, that was the index case, the individual first identified as positive. And sadly, over the last 36 hours, 2 additional individuals have succumbed to the disease. Now, those deaths are not yet reflected on the New York State Department of Health dashboard. And remember, our death numbers, the data related to deaths, on the Dutchess County dashboard is merely a reflection of what is inputted at the state level. So once it's included in the state dashboard, you'll see those 2 additional deaths identified on the Dutchess County dashboard. So of the 145 active cases in Dutchess County on the dashboard today, 40 of those are related to Hedgewood. These are 40 individuals who are Dutchess County residents, staff and or residents who are Dutchess County residents who are included in the active cases. And additionally, of the 44 active cases identified in the city of Beacon, 34 of them are related to Hedgewood. So the bad news, of course, is that we are continuing with a very a strong sense of concern and urgency to address what is a critical concern of a cluster at the Hedgewood Assisted Living Facility. We've been working with the state of New York, with the administration there, to slow and certainly contain the transmission. I'm very grateful to Mayor Lee Kyriakou, the city manager, Anthony Ruggiero, and the City of Beacon Police Department for being a part of assisting us in enforcing the quarantine requirements and communicating with city residents, and also our own staff at the Department of Behavioral and Community Health, who have taken this exceptionally seriously from the very first positive case. The need to contain that cluster, very critical. This is a population that can and will, we will likely see continued transmission. Some of those cases may become severe, and as we said last week and experienced these last 36 hours, we may see additional deaths related to the transmission in this particular facility. Now, the good news is, as a community and a county, we have the lowest transmission or positivity rate in the region. We are seeing continued decline, as I said, 0.8%, and we are not seeing widespread community transmission. So we're still monitoring about, as I said, 145 total cases. You can assume about, as I said, about 100 are not related to Hedgewood, 101 not related to Hedgewood, with 44 related specifically to Hedgewood. And let me just say that we've gone weeks without seeing individuals succumb to the disease. We have not seen a rise in hospitalizations of late, although we are going to, in the regional hospitals, might be Mid-Hudson Regional for emergency room care, maybe St. Luke's across the river. But our thoughts and prayers go to those families who have experienced this loss, and to those families who I know either watch or communicate with us who are unsure as to what has been going on at the facility. We continue to work to ensure that you're communicated with. So we'll keep you updated, but it is of critical concern, and we're going to continue to monitor the conditions there and also work to respond and contain. You likely know that we begin in just a few weeks the release of the Dutchess County budget. It's my job as county executive to present to the Dutchess County Legislature a proposed budget. I will do so on October the 28th of this year. I'm required to do so by November the 1st. Our 2019 year-end financial report was completed and sent to the New York State Comptroller's Office, as is required by law. And I've said this before, Dutchess County could not have gone into this prolonged economic crisis, this pandemic, this public health emergency any stronger than we did. In fact, as a county, we really had as best a financial and fiscal strength as you could hope. Our audited general fund balance, this is our rainy day fund. We closed 2019 with nearly $57 million in reserves, and that is crucial this year. We have seen massive loss of revenue and significant increases in both pandemic and emergency response costs, along with the state of New York either freezing or shifting its cost burden onto county governments. So I'll release a proposed budget at the end of October. We recognize, and you should know, that this is going to be among the greatest fiscal challenges we faced in generations. When I came into office, we were facing a financial burden, a $40 million budget gap that we were able to overcome, replenish our fund balance, and we saw great economic recovery. Those 8 years, we provided property tax reductions, tax rate reductions, and really held the line on spending at about 1.5%. That enabled us to replenish our fund balance and ultimately provide for that rainy day fund. Well, it is, as you know, raining, and as difficult as these challenges will be for county government, I recognize, and we all recognize in county government, that they will not be greater than the challenges many businesses and families face even today, whether it's through economic and financial loss, the concern regarding your own employment, or sadly the loss of life, or the concern for those in your family that may be dealing with health concerns. Those always will be greater and more severe and more important than the challenges we face as a government. All of that said, however, as we prepare to release the 2021 budget, we are committing to several things that I think are important to you. Number one, we will not raise property taxes. The 2021 budget will not include any property tax increase. I'm hopeful that we could provide a rate reduction, but we will not raise property taxes in 2021. As a commitment to providing the best degree of services we can, we initiated a furlough. We provided some relief to county taxpayers this year by reducing some of our discretionary costs, if you will. Despite the state still pushing down on us on mandated expenditures, we are held the line on travel and non-essential spending not associated with the emergency. And at the same time offered an early retirement incentive. 150 individuals will have taken advantage of that early retirement incentive, a way to provide us savings both this year into next year. And because of that, the 2021 budget will not include any layoffs. We will not eliminate the jobs of any individual working for county government in 2021. You will see when I propose the budget that there will be a modest reduction in the total number of full-time positions in county government, because those are the ones we believe we can eliminate entirely. We're doing it through attrition and this early retirement incentive. There will be others that we simply leave in the budget, but budget at maybe $1, just so that we don't eliminate a critical position that if we were to see a rebound in revenue or were to see federal aid given to us, we could replenish and reestablish those positions. But all of this means that there will be a reduction in county spending. And at the same time, we will be constricted in how we provide services. We'll talk about those things and the initiatives that we'll lay out for 2021 in the coming weeks, but I want you to be aware of that. And so if you have a question, I know there are a couple in. I'll take a few if you want to write them in the comment section below the live stream. We'll do that. Stephen asked about enforcement of COVID-19 regulations, not enough masks, too much mass gatherings. Stephen, first thing, the good news is over the course of these weeks, we are not seeing widespread non-compliance with the guidance. And every day, Assistant County Executive Ron Hicks works with the state to identify complaints that come into the state's website. We respond to those as effectively as we can. We take very seriously our responsibility, and thankfully, we aren't seeing widespread transmission. Dutchess has the lowest positivity rate in the region. We are seeing some relative decline, but we have to remain vigilant. So to everyone watching, no matter what it is you feel or how it is you feel it, we are committed to those very basic expectations. Please continue to engage in that physical distancing, no large gatherings, and continue when appropriate to wear a face covering. These are the basic expectations we have. We're asking residents, as we have all along, to be considerate of one another and to adhere to those guidances, and we'll continue to see advancement in both protecting public health and getting back to living our lives. So we're very committed to that. Joni's asked if Hedgewood residents still walking the streets. If you're aware of an individual who's a resident of Hedgewood that isn't aware of their quarantine, please advise us. But thanks to the City of Beacon Police Department and Mayor Kiriakou, we have enforced the quarantine. I think that certain residents are permitted to be out in the yard to smoke and get some fresh air, but they are to remain on the property and return to their residence for the full 14 days. They're still under quarantine. Hedgewood administration has agreed to be vigilant in adhering to that quarantine. Our staff has been in regular communication with residents and others there. And as I said, the City of Beacon Police Department has been helping us, thanks to Mayor Kiriakou and Anthony Ruggiero, assisting us in enforcing the quarantine requirements. So we're hopeful and we'll continue to monitor. If you're aware of any area of concern, let us know. But we are working very aggressively to ensure that we're not transmitting the disease. And based on the numbers in the City of Beacon and the transmission rate outside of Beacon, thankfully we believe it is contained to that residents. That's not to say we aren't going to see other positive cases, and it's not to say we might not experience other clusters. Just at this moment, Dutchess County residents are doing as best as we can expect, and we'd ask you to continue to adhere those guidances so that we can continue to progress forward. If you're following New York, New Jersey, and Connecticut's travel advisory announcements. Arizona and Virginia were removed from the travel advisory list, and Colorado was added. So now there are 34 states and territories on that advisory list. Remember, if you choose to travel to one of those locations, or someone does travel from one of those locations, you are asked to self-quarantine for 14 days. So Arizona and Virginia removed from that list, which is news to my wife's ears, music to my wife's ears, because my in-laws are in Virginia. So I guess we're going to go visit my in-laws sometime soon. But nevertheless, we want you to be safe, and please, to the extent you can, adhere to those guidances. As I said, as we kind of look at how we are budgeting in 2021, you have already experienced a little bit of how we're having to modify a lot of our services. Several of you have asked from time to time about our senior centers. I wouldn't expect them to open anytime soon because of the vulnerability of that population, but we've had a great deal of good programs. I want to thank Todd Tancredi and the staff at the Office for the Aging and all of our volunteers for really putting on a real great series of services these last several months. And coming up, the Office for the Aging Drive-In Bingo. So if you're a bingo fan, they are hosting 3 drive-in bingo opportunities. This is a fun and physically distant bingo, and they will be held on October 14th at Bowden Park in the town of Poughkeepsie, on October 20th at the Dutchess County Fairgrounds in Rhinebeck, and on the 22nd of October at Boyce Park in the town of Dover. And these are just one way that the Office for the Aging is adapting our services. We were just out, Senator Sue Serino and I helped sponsor a Tai Chi class. You'll see that on our website. Take part in that. I will say that I'm not used to moving that slowly, but nevertheless, it was a great experience for those who participated. Our Medicare 101 classes and senior exercise programs are all going online this fall, so you'll have an opportunity to participate in those. And in 2021, Office for the Aging will continue to reimagine the activities we provide to seniors through use of tablets, virtual meetings and classes, and other efforts. So we are in the last several weeks, and now in the last several moments of this town hall meeting, but we're in the last several weeks of the census count. What is the census? A lot of people have still asked me, what is this about? This is not something new. The United States Constitution, when adopted all those years ago, and I don't know if you know this, but the U.S. Constitution in the state of New York was ratified just down the street at the Dutchess County Courthouse here on Market Street in Poughkeepsie. It included the requirement of the federal government to count the number of Americans, individuals living in this country every 10 years. We are in the midst of that census count. And so every 10 years, the federal government, through the U.S. Census Bureau, engages in accounting of every resident of the country, every citizen of the country, every individual in the country. And we are in the process of, through our Complete Count Committee, led by John Penny and a great diverse group of stakeholders countywide, and we are trying to count everyone. So here's the thing. The federal government, the U.S. Census Bureau, under the direction of the executive branch, shortened the number of days that you can conduct the count. This, as I understood it, came from the White House. We don't agree with it. They actually reduced the amount of time for the census. There was a federal lawsuit that resulted in a federal injunction with the Secretary of Commerce announcing a new target date of October the 5th to conclude the 2020 census self-response and field data collection. So that, as with all things in 2020, in particular from the federal government, we learned of that through a tweet. Nevertheless, there is no additional information. We expect to have some clarity tomorrow. So again, federal government announced, I think pathetically, a reduction in the amount of time to complete the census. There was a court injunction that resulted now in the Secretary of Commerce saying that the census can continue till the 5th of October. We'll have some additional information for you. But no matter when it's over, we are still focused on getting everyone counted, and I want to thank our Complete Count Committee, partners in the not-for-profit communities who've been out there helping, and of course our supervisors, mayors, towns, villages, and cities. So the Dutchess County self-response rate for 2010 was 65.7%. So we know, based on the number of households in 2010, 65.7% of Dutchess County residents participated in the census. As of today, 66.5% have participated in the 2020 census. Here's the point. Boils down to this. Visit 2020census.gov now. In fact, hang up. Disconnect. If you haven't finished the census, fill it out. It is so critically important. It's just, I think, 10 simple questions. All of the information is confidential. In fact, census workers are prohibited by law and under penalty of imprisonment from sharing information. There are, however, areas in the city of Poughkeepsie that we need you to be more effective. So get out there. In several neighborhoods in Poughkeepsie are reporting less than 50%. Northeastern part of Dutchess County still a little bit behind. We're very grateful to the town of LaGrange. They've had great response. But listen, if you don't live in LaGrange, do you really want to lose to LaGrange? I mean, I'm very grateful to LaGrange, but if you live in any other of the 19 other towns in Dutchess County, you want to beat them. And so I'm sending out a challenge to all my friends throughout Dutchess County. Do not let Alan Bell take credit for having the highest response rate as supervisor of the town of LaGrange. So I'm talking to the folks in Northeast and in Dover and in Menia, the folks in the town of East Fishkill and Red Hook and Rhinebeck, and all across Dutchess County. Take this chance to encourage your residents, please, and your neighbors to complete the census. It's critical. Billions of dollars will be distributed based on the number of people who live in Dutchess County. And that means our block grant money that goes to infrastructure investment. It means housing dollars. It means transportation dollars. All of that gets dispersed based on population. We want 100% of Dutchess County counted. The other, of course, is when it comes to apportioning districts for Congress every 10 years, that we have to assign new districts. And you want every one of your votes, every one of our neighbors counted so that we have the greatest weight in the United States House of Representatives. And if you're concerned about votes upstate versus downstate, the state legislature is apportioned based on population. We want to make sure that we get the greatest weight and the loudest voice in Albany as well. And then, of course, our own county legislature once every 10 years has to reapportion. And next week, we'll talk to you a little bit about a ballot question that you'll have to take part in. On the back of your ballot or on the front of the ballot, depending on, I guess, how it's been printed, is a referendum question. The county legislature, in partnership with us, developed an independent reapportionment process. That means that they're stripping the politics out of reapportioning legislative districts. Politicians won't pick their voters. This is an independent committee that would be established to conduct the reapportionment. No political influence, entirely independent, but you have to vote for it. So I'm not entirely sure that I can tell you to please vote for it, because I'm not sure that I'm supposed to lobby people from a government office, but I'm voting for it, and perhaps you might join me in supporting that referendum. We think it's critically important to have that independent reapportionment, but we'll talk a little bit more about that next week. And with that, let me just remind you that we are in the midst of flu season. For those of you who choose to get the flu shot, please choose that. If you choose not to, that's your call. Entirely up to you. I know I choose to get the flu shot, and we're in the midst of that. And, of course, you can get a flu shot at a doctor's office. You can get a flu shot at a pharmacy, several of our larger retailers like Target and Walmart. And if you need assistance, you can always reach out to the Department of Behavioral and Community Health. We have our flu shot clinics you can reach us at 845-486-3535 or clinics@dutchessny.gov, clinics@dutchessny.gov. And with that, if you have any questions related to COVID-19, our continued response, or if you too are interested in being tested for COVID-19, you can visit dutchessny.gov. In the meantime, thanks for joining us. Be well, stay healthy, and keep being kind to each other.